Hello, everyone. Good evening to everyone. Thank you very much for joining us for another Facebook Live. Hopefully you find this informative, descriptive, and very objective information. And again, as what I have said in the past, today's is a very special Facebook Live in a sense that I'm going to just read what any patient should have read who got implants, be it for augmentation purposes, for reconstructive purposes after breast cancer, and that what are the implications for getting breast implants. This is true for anyone, young college student who's considering getting implants, or any patient who's been diagnosed with breast cancer. And again, as you will see, this is not going to be my opinion. These are words that I'm going to just read out loud from the manufacturer first, and we will go ahead and get started very soon. So please feel free to ask any questions. As you will see, we'll get into a lot of detail. And you will see this is the objective evidence that I've been talking about. And the goal here today is to discuss what I saw in my clinic today, what I see every day, literally what I talk to about with the many ladies from all over the US and all over Europe, South America, and the world that bring about their problems of what we already know. So having said this, I'll go ahead and get started. So this is out of the 𝐼𝐻𝐻 website. So I just went to 𝐼𝐻𝐻.com, and I want each one of you to read. It's a very easy read. So 𝐼𝐻𝐻, these are the 𝐿ERGAN/𝐻𝐻 implants. And I'm just going to go ahead and I am going to go to the second page. And these are the highlights on their webpage. And I'm going to go ahead and read this. So 𝐻𝐻 breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. This is the black box warning that we all know of. Breast implants have been associated with the development of cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Now, we all know this is underreported, and this is a very rare of rare, but this is where if the surgeon is not thinking or not testing, this certainly will get missed. Last year, I had 3 of my patients who had CD30 positive, which highlights what are abnormal cells suggestive of what is the BIA-ALCL. Next quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. As you can see, they're telling you that breast implant illness exists. This is the autoimmune diseases, chronic fatigue, confusion, muscle aches, joint pain, and others. Remember, this is what, by definition, is what is breast implant illness. What you will see in my questionnaire, this is the many other symptoms. So if you go to my website, you will see chronic fatigue, the most common symptom that the patients exhibit, brain fog, muscle aches, pain, weakness, joint pain, soreness, hair loss, dry skin, eyes, mouth, weight gain, weight loss, easy bruising, temperature intolerance, low libido, autoimmune diseases, night sweats, skin rashes, insomnia, estrogen progesterone imbalance, swollen tender lymph nodes, tingling numbness in the arms and legs, burning around the chest and breast, cold discolored hands and feet, foul body odor, muscle twitching, vertigo, fevers, dehydration, frequent urination, chronic neck and back pain, photosensitivity, nail changes, rashes, edema around the eyes, premature aging, thyroid, adrenal problems, decline, changes in vision, dryness of the eyes, for example, slow muscle recovery after activity, liver, kidney problems, gastrointestinal digestive issues, sudden food intolerances, chemical sensitivities, persistent infections, suicidal ideations, shortness of breath, heart palpitations, difficulty breathing, oral thrush, symptoms, diagnosis of fibromyalgia, feeling like you're dying, chronic inflammation, recurring sinus, yeast UTI infections, throat clearing, difficulty swallowing, choking feeling, headaches, dizziness, migraines, anxiety, panic attacks, which are a major component, psych issues, mood swings, emotional instability, depression, metallic taste in the mouth, symptoms, diagnosis of Lyme or ringing in the ears. So these are the symptoms that they classify as, and again, reading, and others. So remember, it's a whole series. Not everyone has these, small subset, but these are important to note. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Now, this is the black box warning that the FDA has issued. Now, what I'm going to do is I'm going to continue to read. This is again on the Natrel website. Who can get breast implants? Natrel breast implants are approved for the following: breast augmentation for women at least 22 years old. Today I saw a patient at age 18, she got silicone implants, which is wrong according to the guidelines here. So breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size, and then they mention breast reconstruction again for cancer patients. So again, I want each one of you to listen to what I'm saying, and then certainly after this presentation, please go to the website and read for yourself. And we will have this on our webpage as well. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in the body. Makes sense. Women with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions. Now, in some certain cases, there have been cases where the patient got the mastectomy and the lymph nodes were sent, and then later on, once the tissue expander is placed, now the patient ends up getting positive lymph nodes and cancer. Now the patient has, for example, an infection, or because now they want to get chemotherapy. Because of the infection, now the patient is not getting chemotherapy and the chemotherapy is being delayed. I find it is unfortunate that the priority is given to the aesthetics and not to treating the cancer. So next, women who are currently pregnant or nursing, so should not get breast implants. Very interesting. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. So autoimmune diseases such as lupus, scleroderma, a weakened immune system, taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to the breast tissue, for example, diabetics, patients who are old, compromised blood supply, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder or eating disorders. Those with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. Now, what's interesting is there are many patients who have, as you heard in that checklist, mood instability, anxiety, depression. Some patients never had any of it. Some patients had a little bit of it, and now their symptoms worsened dramatically. So they're telling you you should discuss this, and you're certainly at risk, higher risk than the average person. What else should I consider? And it's very interesting, and I'm going to read this. I'm going to remove my glasses so I can see. There is a boxed warning for breast implants. Please see the bold text at the beginning. That's the one that I read very early on. Many changes to your breast following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes which may be permanent. So that's a big deal. So once you get surgery done, you may never be able to get the aesthetic result that you may desire because of the effects that are irreversible. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of ruptured silicone gel-filled breast implant have not been fully established. I'm going to stop here. I will tell you it is not healthy or safe to have a ruptured breast implant. Otherwise, why would be they getting the screening? Next, routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. That's a big deal. Remember, 1 out of 8 or 9 women will get breast cancer, and they're telling you implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. This is all on the Natrel website. And the next thing that I highlighted, key complications include reoperation. What are the key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline implants, and capsular contracture, that is severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability and visibility. So these are on the Natrel website. Now I will tell you, if I'm a patient just looking on their website, Natrel, I would be very scared about getting these implants, knowing what I know. And remember, this is what you need to be informed by your plastic surgeon. Now, what the FDA did was, and this is the next part. Now remember, I did not write this. This is coming from the manufacturer. This is coming all verbatim, quote unquote. This is not my opinion. This is from the manufacturer. Now, this is the second part that I want to discuss. This is from the FDA. Breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff. So this was a document issued on September 29th, 2020. And I want you to please read this. Again, we will have this as a link on our page. So I'm going to go ahead and go over it. It's a 19-page document. They talk about the preface, the table of contents, introduction, background, scope, labeling components, additional labeling recommendations, boxed warning, patient decision checklist example, and then material device description example. So now the FDA, now remember this is on the FDA.gov, and you will see this, not my opinion, this is from the FDA. It tells you the FDA's guidance documents, including this guidance, do not establish legally enforceable responsibilities. Instead, guidelines describe the agency's current thinking on a topic and should be viewed only as recommendations unless specific regulatory or statutory requirements are cited. The use of the word should in agency guidance means that something is suggested or recommended but not required. Now, this is very interesting because this is very lawyer-like English. So they talk about the background, they talk about the 2 types of implants, they talk about BIA-ALCL, and then they talk about the scope. And I want you to read through this. This is a relatively easy read. In the interest of time, I'm just going to highlight what is on the next page, which is page 4. They talk about on page 4 the box warning that I just read that the Natrel has. That boxed warning, and I'm going to kind of read between the lines. FDA believes that a boxed warning should be part of the physician and patient labeling materials for breast implants. That they highlight, FDA recommends that a boxed warning generally inform patients that breast implants are not considered lifetime devices, the chances of developing complications increases over time. Some complications will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called BIA-ALCL. So this is more or less, what we saw on the trial website. Then it says BIA-ALCL occurs more commonly in patients with textured breast implants than smooth implants, and deaths have occurred from BIA-ALCL. And then breast implants have been associated with systemic symptoms. This is consistent with BII. What are the systemic symptoms? This is the checklist that I read out to you earlier. So FDA believes that this form and content of box warning will help ensure that the patients receive and understand information regarding the benefits and risks of these devices. Now, this is the patient decision checklist. First, FDA recommends that their introduction for the checklist include a description of the purpose and importance of the checklist. And then they say FDA recommends that a copy of the patient decision checklist be provided to the patient so that the patient can refer back to this important information. Now remember, this is all part of informed consent. Before you get a hip device, before you get a pacemaker, the doctors are respectively talking to you about the risks, implications, long-term effects of these devices. So this should not come as a surprise where the FDA has to require a checklist so that the surgeons talk to the patients. The surgeons should be doing this automatically, so that Facebook Live I did with Tracy and Don last week, there should be no purpose for that mandate for the informed consent, because every plastic surgeon must be doing this, and this is part of the ethics of getting informed consent, so that when a patient signs for an augmentation, be it for reconstructive or cosmetic reasons, she knows what are the implications behind. But this is the checklist that the FDA is saying that the surgeons should, and you will see shortly what they want you to know. For asymptomatic patients, the first ultrasound or magnetic resonance imaging should be performed at 5-6 years postoperatively, then every 2 to 3 years thereafter. For symptomatic patients or patients with equivocal ultrasound results for a rupture at any time postoperatively, an MRI is recommended. Next, the FDA recommends that the patient information booklet brochure include tables listing breast implant materials, chemicals that might be released from breast implants, and heavy metals present in the breast implants. So we're going to continue to read. And again, please read through this. In the interest of time, I'm just going to highlight what is the obvious. Here's the boxed warning. And as I go to the next page, you will see the patient decision checklist example. They're telling you this is what should be used by the surgeons to discuss with the patients. This is a critical step in making the decision whether you should choose breast implant surgery. The review and understanding of this document is a critical step in making the decision whether you should choose breast implant surgery. And then consideration for candidates for a successful breast implantation. That, again, the infection, existing cancer, if you're pregnant or nursing, you should not get, I'm not a candidate for breast implant. So the surgeon has discussed this with you. We talked about medical conditions where you have a higher risk for a poor surgical outcome. So medical conditions that affect my body's ability to heal. So patients with diabetes, connective tissue disorder, an active smoker or a former smoker, higher risk for a poor surgical outcome. Currently taking drugs that weaken the immune natural resistance to disease, such as steroids, chemotherapy drugs, prednisone, tacrolimus, sirolimus, methylphenidate. This is basically mycophenolate. These are medications that are methotrexate. These are immunomodulator medications that suppress the immune system. So one of my patients who was my neighbor, she ended up getting implants, and she had a kidney transplant. If you ask me, this was a contraindication. She should not have gotten, in my eyes, a augmentation or reconstruction post breast cancer that she had. History of chemotherapy or planned chemotherapy following breast implant placement. How many patients do we know have tissue expanders or implants that get chemotherapy? and they're telling you that there's a higher risk for a poor surgical outcome. History of radiation therapy. Once someone gets radiation, the risk of problems, complications go up almost 50%. That is correct, 50%. Conditions that interfere with wound healing or blood clotting, hemophilia, von Willebrand's disease, factor V Leiden deficiency, protein C deficiency, reduced blood supply to the breast tissue. And then they tell you, I understand the following conditions have not been adequately studied to determine whether the conditions put me at higher risk. Autoimmune diseases like Hashimoto's, lupus, rheumatoid arthritis, or a family history of autoimmune disease like breast implant. Pre-market clinical studies have not evaluated the safety of breast implants in patients with autoimmune disease, clinical diagnosis of depression, or other problems. Now, risks of breast implant surgery. So they want you to initialize here that you understood what these risks are. Risk of breast implant surgery. I understand the risks of undergoing breast implant surgery. I understand the risks of undergoing breast implant surgery may include breast pain, reported in up to 36.5% of the procedures. Now, if you look at down here, each rate specified here represents the largest percentage reported in any PMA approved for breast implants up through October 2019. So skin or nipple areola sensitivity changes or loss is reported in up to 35% of procedures. Asymmetry reported in 28% of the procedures. Impact of aging or weight change on size and shape of the breast reported in up to 10%. Infection requiring possible removal of the implant reported in up to 9% of the procedures. Swelling reported into 9% of the procedures. Scarring reported in up to 7%. Fluid collections or seroma reported up to 6.5% of the procedures. Tissue death of breast skin or nipple, that is nipple necrosis, reported in up to 2% of the procedures. Inability to breastfeed reported in up to 1.6% of the procedures. Complications of anesthesia, chronic pain, damage to surrounding tissues such as muscle, nerves, blood vessels. Next. So now they want you to continue to put the initials. My physician has discussed these risks and has provided me with the patient information booklet brochure, included the boxed warning with information on the types of risks that are possible and expected rates of occurrence. Then they talk to you about the BIA-ALCL, which is that rare lymphoma, and they tell you over here that I understand that the cancer has been reported more frequently for textured breast implants, but the patients with smooth surface implants have also been diagnosed, so it's less. I understand that, so it does indeed occur with smooth silicone implants and smooth saline implants. I understand that the patients with breast implants have a risk of developing BIA-ALCL within the scar tissue and fluid surrounding the breast implants. So this is why the scar tissue is the capsule that they're talking about. I understand that BIA-ALCL typically takes several years to develop after implantation, but cases have been reported as early as within 1 year. Typical symptoms to be aware of include swelling, breast tightness, pain, lumps, swelling of the breast months or years after I received my implants. I understand the treatment for BIA-ALCL involves an operation to remove the implants and the surrounding tissue capsule. So this is what I do when patients come to me. I remove it completely because we don't want to potentially leave any badness behind and then having to go back. That's why those 3 patients with CD30 positive that I had last year, their surgery was done right to begin with, so the patients have the peace of mind that all of that capsular tissue was removed and all of it was tested. And if there's any fluid, I always send it off to cytology. Quote, based on the stage of the cancer at diagnosis, some patients have required chemotherapy or radiation. While BIA-ALCL typically responds well to therapy, some patients have died from BIA-ALCL. Diagnosis and treatment may be at my own expense and is not always covered by insurance. This is very interesting. And they write this down. This is by the FDA, and they want you, the patients, to initialize. This is part of the informed consent. Every plastic surgeon who has put in implants in patients should be going over this document and having the patients initialize. This is what the FDA is recommending. Next, systemic symptoms. So this is like BII. I understand that some patients who have received breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, rash, memory loss, and brain fog. For some patients have called breast implant illness. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with removal of their implants and surrounding scar tissue capsule. However, not all patients may experience improvement in their symptoms. Researchers are working to better understand the possible link between the breast implants and these symptoms. Now remember this sentence, researchers are working to better understand the possible link between breast implants and these symptoms. I'll tell you, the badness is so bad, the researchers should not work. They should stop augmentation so they prevent this badness from spreading to more people, because the badness is there. Now, quote, I also understand that some patients with breast implants have reported health problems in their children after birth or breastfeeding. This is a big deal. Again, I also understand that some patients with breast implants have reported health problems in their children after birth or breastfeeding. While a causal link between these breast implants and these reported health problems in children has not been demonstrated, more research is needed. I understand that breast implants and breast surgery may interfere with my ability to successfully breastfeed. Initialize. Breast implant specific risks. Quote, I understand that a breast implant is not a lifetime device, and the longer I have my implants, the more likely I am to experience a complication, and the more likely I am to require a reoperation requiring the replacement or removal of my breast implant. As many as 20% of women who receive breast implants for augmentation have to have their implants removed within 8 to 10 years, but my implants may last for a shorter or longer time. So they're telling you, and giving numbers interestingly, I understand that my breast implant may rupture or leak at any time, and that the longer I have my implants, the more likely I am to experience a complication such as rupture. I understand the gel bleed. Small quantities of chemicals diffusing from the implant shell of silicone gel-filled implants may occur. I understand that if I have a saline-filled implant, my breast may deflate in appearance if there is a rupture or leakage of the saline. This is pretty interesting. I understand that the gel bleed. Remember, I talk about this in my Facebook Lives directly from the operating room. I understand that if I have a silicone gel-filled breast implant, I or the physician may not be able to tell on physical exam whether my implant has ruptured or is leaking silicone gel. Because rupture or leakage of silicone gel implants is difficult to detect, I understand the periodic imaging evaluation is recommended for screening of silicone gel-filled breast implant rupture. It is recommended that I have a periodic imaging of my silicone gel-filled breast implants to screen for implant rupture, regardless of whether my implants are for cosmetic augmentation or reconstruction. These recommendations do not replace other additional imaging that may be required depending on my medical history or circumstance. For example, screening mammography for breast cancer. Quote, even if I have no symptoms, I should have regular imaging evaluations as described in the recommended follow-up section below. These imaging evaluations may not detect all ruptures or leaks, be costly, and the expense may not be covered by my medical insurance. So this is very interesting. I will tell you, if I'm reading this and all what I have read, any person, be it female or the significant other, who has listened to whatever I have said. Now, all what I have said is not my opinion. This is verbatim, quote unquote, from the FDA, and each one of you is gonna read this. I would run away as far as I can if someone read me these risks. Now, let's continue to read. I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph node, under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. I'm going to stop here. 1 out of 8 or 9 women are going to get breast cancer, and they're telling you that it's going to hinder mammography, or patients are afraid to get mammography, and now breast cancer screening is not effective. I'll tell you that in itself should be a reason to ban the implants right now at this second, because it is not fair to have a late diagnosis and have a late detection of breast cancer, which could be stage 2, and now it's stage 3 or stage 4. Now I continue to quote. Mammography can also cause the breast implant to rupture or leak. I should tell the mammography technician if I have breast implants. Wow, this is, I use the word crazy. I understand that the long-term risks of breast implants may include painful or tightening of scar, that's the capsular on my implant, capsular contracture, reported in up to 51.7% of the patients. Now remember, you have to look at where they're getting the quote, but this is from the FDA. Rupture or leaking of the implant reported in up to 31.2%. We have to see what length of time, but this is, I'm reading quote unquote, because they're going to have, the plastic surgeon is going to have you initialize here. Wrinkling of the implant reported in up to 20%. Visibility of the implant edges reported in up to 6%. Shifting of the implant reported in up to 11.5%. Need for reoperation reported in up to 59.7%. I understand that I will receive a patient device card after my surgery that has information on each of my specific implants. I understand that it is important for me to keep each card in case I or my physician need to know what kind of implant I have many years later. The longer the time it is, most of my patients do not have these cards. Look at this. I understand that all breast implants contain chemicals and heavy metals. Now I'm really scared. I understand that most of these chemicals stay inside the shell of the implant, but small quantities have been found in diffuse gel bleed through the implant shell of silicone gel fill implants, even if the implant is intact and not ruptured or leaking. A list of the components, chemicals, and heavy metals is available in the patient information booklet brochure. Now this is really, really disturbing. Let's go back to this paragraph. I understand that silicone can migrate from my implant into nearby tissues, chest wall, lymph nodes, under the arm, and organs, liver, lungs, where it may not be possible to remove. Please sign your initials here and get your implants. That's what they're telling you. Even if I have no symptoms, I should have my first ultrasound or MRI at 5 years after my initial implant surgery, and then every 2 to 3 years after. If I have symptoms or uncertain ultrasound results for a breast implant rupture at any time, an MRI is recommended. Now I'm going to, see, look at this, 5 to 6 years. Now I'm going to take a small break. Can you show me? No, I got this right here. Let's look at the Mentor ad. This is the Mentor advertisement, not my advertisement. This is Mentor. They publish this in the journal. They write down, quote, MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture. Silent rupture means on exam the patient has no problems. The plastic surgeon examines and says there is no rupture, and lo and behold, you get an MRI and it shows a rupture, or the surgeon goes in to remove and there is a rupture. So the Mentor is telling you 3 years and then every 2 years they're onward. Over here, they're telling you 5 to 6 years after my initial implant surgery and then every 2 to 3 years after. So this is very relatively lax, but still significant. Today I saw a patient who had implants. 38-year-old lady came in from Florida just for the consultation. She and her husband flew here to see me just for the consultation. She is 38, no HIPAA violation, and she got her implants 20 years ago when she was 18, and she got silicone implants. So if, according to this, what I have read, the surgeon should not have put in an 18-year-old silicone implants. She should have gotten an MRI at least 9 times according to the Mentor, because she had the Mentor implant. So if you continue to read over here, you would be like more aghast, more shocked. I'm going to continue to read here. Questions from my physician. I have had the opportunity to ask my physician questions about his or her experience, medical degree, specialty of training, and credentials. I understand that breast implants have associated procedural risk and should only be used by physicians who are appropriately trained. What is even ironic here is there are ENT doctors, there are emergency room doctors right here in town and across the U.S., surgeons who are not even board certifiable, who cannot practice in the hospital, who are putting in implants in their private surgery suites that are not even certifiable, and that they are basically violating this section right here because they're not board certified plastic surgeons. They're wannabe plastic surgeons. I understand that the breast reconstruction is an elective procedure which I can choose to do or not. Now, believe it or not, I talked to one of the major plastic surgeons here in the country, and I asked him, he said, well, this is an elective operation, so the patient is taking a risk because she could choose not to, and if she runs into problem, she knew the risks of getting it. The problem here is what? The patients do not know any of what I have read. This is not, I didn't type this. This is coming from the FDA.gov. And this is, as you saw, the consensus from 2020. Let's continue to read. I understand that if my breast implants are ever removed, I may be left with dimpling, chest wall concavity, puckering, or sagging of my breast or skin. So this is a significant problem. Next, breast augmentation options. I understand that the breast augmentation is an elective procedure. I understand that breast augmentation may result in permanent changes to my breast tissue, and if my implants are ever removed, I may be left with unsatisfactory appearance, changes to the size and shape of my breast, including but not limited to dimpling, chest wall concavity, puckering, sagging, or different incision size or location. If I am an augmentation patient, that means cosmetic, any additional surgeries or medical procedures will likely be at my own expense. Unbelievable. And then initialize patient signature and date. And now let's look at the appendix for material device description example. The potential toxicity of the chemicals and metals listed in the following tables has not been evaluated with both toxicity testing and risk assessment to assess the exposure levels in comparison to the amount determined to likely be safe. I'm going to read this again. The potential toxicity of the chemicals and metals listed in the following tables have been evaluated with both toxicity testing and risk assessment to assess the exposure levels in comparison to the amount determined to likely be safe. However, individual responses to chemicals may vary and all reactions cannot be predicted. So they're telling you that we do not know. In general, we have done it, but there are exceptions. Breast implant device materials. Device materials, this is the shell. Dimethyl silicone, diphenyl silicone, MED 4750 silicone elastomer, silicone gel in the gel fill, and platinum catalyst in the shell and the fill. Chemical released by breast implants, volatile, meaning it's gas. Chemicals that are released by breast implants as a gas. Extractables, chemicals that are released by breast implants following soaking in water and or organic solvent liquid, and in this case a saline. So tell you D3 siloxane, D4 siloxane, methyl oxytrimethyl silane, and look at whole device parts per million compound. All these, isopropanol, ethylbenzene, decane, limonene, and again, the total volatiles, heavy metals found in breast implants, antimony, arsenic, barium, beryllium, cadmium, chromium, cobalt, copper, lead. Magnesium, mercury, molybdenum, nickel, platinum, selenium, silver, tin, titanium, vanadium, and zinc. And again, this is guidance for industry and Food Drug Administration staff, document issued on September 29, 2020. The recommendation in this guidance supplements the recommendations in the FDA's guidance, saline silicone gel, and alternative breast implant guidance issued September 29, 2020. So, the first thing I want to mention here is, thank you very much. The first thing I want to mention here is anytime you get any procedure, let's say you want to get your gallbladder out, the surgeon will sit down and say, you know what, these are the risks, these are the benefits, and you basically cite. In this case, when you get breast implants, all what I read is not my opinion. These are from the manufacturers. You saw the mentor, and then you saw ultimately the FDA checklist. This is part of the informed consent. Now, this is something that every patient, when they walk into my clinic, like today, almost all of them, they were never made aware that they're not. They've been told that they're lifetime devices. Incorrect information. They are not lifetime devices. as you have seen many times. They are associated with the BIA-ALCL, very small amount of to date, only 1,233 cases plus minus have been reported all over the world. But we know as plastic surgeons, as plastic surgery societies, this is, and medical and surgical oncologists, this is a very much underreported, because nowadays not many people are excited about removing the capsule. And even when they do remove the capsule in those rare circumstances, they're not being sent to pathology. And even when they're sent to pathology, the CD30 analysis and ruling out lymphoma is not being done. And so they're certainly missed. And they have projected, this is the plastic surgery community, that over the next several years, we're going to see the rate go up as now more and more awareness is being brought up. This is where if anyone has any suspicion or MRI or any imaging shows that there is fluid, that fluid is BIA-ALCL, BIA-ALCL till proven otherwise. So one has to always assume the worst and be thinking about the worst, that the implant is ruptured. How many times have I seen a patient where the previous surgeon went in and they said, oh, your implants are just 6 years old, 8 years old, they cannot be ruptured, and lo and behold, the silicone was ruptured and there is free-floating silicone. Silicone has been found, as you saw, this gel bleed is a real phenomenon. They're talking about it. They've been found in the lung and the liver, which we know from Dr. Henry Dykman's studies, right? If you look at the many ultrasound/MRI reports, the patient has an intact implant and there is silica within the lymph nodes. This is not surprising. We already know this. We saw Dr. Atul Mehta. I interviewed him. He's the pulmonologist at the Cleveland Clinic from several years ago. He did a biopsy of the lung and the patient had what was silica within the lung tissue, underneath the rib, and this traveled to the lung via the bloodstream. And remember, this is a cause for concern. I'm not trying to use scare tactics. I will tell you from a financial perspective, it would make only sense for me, financial, and also from a physical perspective, because I'll tell you, these surgeries are not easy. They're telling you they're relatively very hard surgeries. There is a consensus by the Canadian government, by the European countries, by the US plastic surgeons that explant surgery where removal of the capsule is done is expensive, dangerous surgery, and uncalled for risk. I will tell you, if anything, if I am a patient, knowing what I know, knowing what I read, I would want a complete peace of mind so that all of that capsular tissue is removed and all of what is removed is tested, and my surgeon is a firm believer in breast implant illness, and that he or she is not putting in implants, and he or she is discussing this. Every patient who got an implant, if they don't say, well, my surgeon made me sign and initialize on the risks, their plastic surgeon has violated what is do no harm, because the patient did not give that consent. And you hear the patients, if one after another, saying my surgeon said their lifetime device is incorrect, that they're very benign, and that I'm exaggerating these risks. No, I'm not. They're telling you they're not lifetime devices means if 100,000 ladies get implants, be it that 20% you read 8 to 10 years, or be it 3 weeks ago I took care of a lady 89 years of age, and she got her implants in 1973, and I removed her implants 52 years later. Her time came up, and she had what was one of the worst cases I have done. And I did her surgery because she had pain on her right side of the chest. She couldn't sleep, she couldn't sit, she couldn't take a nice deep breath. And if you look at that explant that I did 3 weeks ago, you will only be convinced that that certainly did not belong in the patient, given the risk versus benefits. And I did the case at the hospital. And we certainly will discuss her case in the next few weeks, when she's 6 or so weeks out from her surgery. So the take-home message is, and this is my take, and I'll say 5 things, and then I will answer any questions that you may have. Number 1, all what I write right now is not my wording. It is wording on the Mentor website, on the Natrel website, Natrel.com, and on the FDA website as far as the patient checklist. Number 2, any patient who has gotten implants, this should not be as a surprise or news for them. that this gel bleed, leaching of the silicone into the periphery, that you're going to be responsible for the subsequent MRIs and any problem complications, that you're going to be responsible. That is very heavily put forth. And number 3, this is part of the informed consent that should not be directed by the FDA to tell the doctors to tell their patients. The surgeons should be doing it themselves voluntarily, because this is part of that ethical informed consent. Number 4, do your homework, do your research. If that lady that came to me from Florida who had implants put in, silicone, which was wrong at age 18, and she goes to the top 100 hospitals in the country, all 100 hospitals would inevitably tell her, we're going to put in another silicone implant, you deserve the best, you're going to be depressed, you're not going to look nice. And she had almost every checkbox that you can imagine. For someone 38 to be going through this, it's wrong, it's disrespectful, and certainly I would call arrogant, because you're overlooking the patient's misery for your financial gain, because that's essentially what it boils down to. Knowing what we know now and knowing what we know from the past, there is a mountain of evidence that calls for the implants, be it saline or silicone, to be banned now, so that we can stop this pain and misery, and these patients benefit from an explant, and that they get a complete and thorough explantation, so that the patients have the peace of mind that they're not going to have any potential complications, that they're going to potentially recover. How many of my patients that I have seen that had ruptured silicone spill into the chest, residual capsules where they were not improving, and only when did I go in and remove the residual capsules did they improve? And you will hear directly from them, not only on my Facebook page, but from those other surgeons who are very good about removing the residual capsules. You have to do your homework. You have, those ladies who are strongly considering getting implants, listen and read and understand what are the long-term implications. So if a lady gets implants in her 20s, you will see that she should and would have replaced her implants at least 6-8 times in her lifetime if she lives to 82, which is the normal lifespan of a lady in the US. These devices are not safe, they're replete with problems, and if you factor in each one of the problems that I read, you should run as far as possible from getting something that is not at all, in my eyes, safe and worth it. So having said this, I am going to go ahead and see if there's any questions one may have. So please ask any questions. I know I ran over, and I'm glad I did. You know, I will do a subsequent follow-up question-answer session. Do your homework, do your research. Today I met many ladies who came to me who had done their homework. They read up on my Facebook page, YouTube. After some time, you will see there's only 18-20 questions that one can ask about the twilight sedation. Are the drains required? Why do you not do a lift? And what are the goals of the surgery? What is the twilight sedation? Do you send the capsules off to pathology? Do you take cultures? And in my practice, as you will see, this is where my patients come to me. They know what I'm going to do. And this is the con procedure, and I'll end with this. Number 1, the patients get the implants back so they know what they signed up for. Today I saw a patient, she came to me and she was a physician actually, and she said, I have saline implants. When I saw her card, I said, I beg to differ, you have silicone implants. And she was very much upset when she heard that, and I said, that's why I returned the implants. So I returned the implants to the patient. Number 2, twilight deep sedation, very practical, effective anesthesia. Number 3, the capsules are sent to pathology always. Rule out the rare BIA-ALCL, CD30 analysis done, rule out lymphoma, rule out malignancy, rule out squamous cell cancer, rule out breast cancer, rule out anything abnormal. Number 4, cultures are done for bacteria and fungus, aerobic, anaerobic, and fungal. Number 5, no need for drains. I've not used drains in any of my patients in well over 5 years now. Number 6, no need for that unnecessary lift. I've done lifts before, but not in every patient. As you will see with the pseudo lift, with the excess skin removed, with the recoiling of the skin, with the fluffing effect between the inflammation subsiding, between the implant that's pulling the breast tissue down being gone, and now the breast tissue recoils, and the internal sutures that I put, and between the 5, 10, 15% muscle mass that the ladies add to their chest when they work out afterwards. Most of the patients do not need that unnecessary lift. We will discuss that 89-year-old lady that I did 3 weeks ago. When you see her results, she did not need a lift, and you will see those pictures for yourself because her surgeon did a very good job doing her surgery in 1973. I take high definition pictures and videos of the chest wall showing complete removal, and on the table complete removal. Remember, there is no HIPAA violation in doing that because the patients need to know, want to know what exactly was done. Remember, this is the bind that the patients have with me, so that I voluntarily share this with them so that they have the peace of mind that all of the capsule was removed along with all of the inflamed tissue, and that if this was a ruptured silicone, all of it was contained in en bloc or 100% total capsulectomy. And last but not least, depending on the age or the comorbidities, all patients get the same surgery. I don't try to compromise or shortcut the surgery because one patient is older or sicker than the other. Every patient gets and deserves the best care. Yes, I have turned away patients that had liver cirrhosis or that had problems such as bad radiated burn to the chest, or this patient has an active infection, or another patient that has an active cancer. I do not want to operate on these patients. The patients need to be cancer-free when I see them so that they get the best and the same care that I offer all my patients, because everyone deserves world-class, what I would say, complete care, so that when we look back at it, I will say with confidence I removed the whole capsule inflamed tissue and the implant, and all what was removed was tested, and the patients are aware that it was done definitively with pureness of the heart and the only intent that the patients benefit and improve from their symptoms. So having said this, I'll go ahead and wrap this up. This is Dr. Khan. Please ask questions. Do your homework. You don't have to be in the medical field to be a doctor. You could be a physicist at University of Michigan. You could be a hairstylist. You could be a business owner. You could be a stay-at-home mom. After some time, you will see it doesn't take much between the YouTube videos and the Facebook Lives. Even talking to some patients, they will hold your hands and they will guide you so that you truly comprehend when you do come to me what is it that the goal of the surgery is. This is Dr. Khan, Executive Plastic Surgery.